I'm Dr. Matt Linger. I'm the Director of the Bariatric Service here at Rapides Regional Medical Center. We're here today to talk about obesity, what it is, some of the statistics behind it, how it impacts people's health, and ultimately what we can do about it, because we have some really effective and interesting tools that people can use. Obesity is defined as having something called a body mass index, a BMI greater than 30. Not every person who has a BMI greater than 30 has it because they're fat. We think of NFL players who very often have a BMI of 30 or 35, and that doesn't happen because they have extra fat or too much fat in their bodies. But for most of us, once your body mass index gets 30 to 35, we're starting to see either health problems or we're starting to see the risk of health problems happening. If you're wondering what your BMI is, there are many calculators on the internet that do the formula for you. It basically just takes your height and your weight into account. Once we see folks move their BMI greater than 30, we start to get concerned. Especially I start worrying about sleep apnea, high blood pressure, and diabetes. But we know that being obese has many other health risks that are associated with it, including the risk of many types of cancer, breast cancer, endometrial cancer especially. But I feel like every week I'm reading new articles that point out that new types of malignancies, new types of cancers are associated with obesity. In addition, folks develop sleep apnea, they develop high blood pressure, many of them develop high cholesterol. We see women who develop polycystic ovarian syndrome, and often we'll see folks who are having back pain, lower joint pain, or just not feeling up to themselves and more run down than they would have otherwise. So I feel like the more I read and the more I study about obesity, the less I know about it. Everyone who says that they have a reason why we're getting fatter than our ancestors were, when I start drilling down into some of the reasons, none of them can really explain all of it. Certainly we're eating more calories, we're eating more processed food, we're not as active as folks were in decades past. None of that really explains it to me. Which means that I don't think that we can just say that obesity is simply a matter of willpower. There are any number of folks who benefit off of us feeling shame about our weight and then want to try to take money out of our pockets to pay for some way to lose weight. Folks are selling books, or they're trying to sell their podcast, or they want to see more attention online, or they're trying to start some new therapy. And it's exhausting seeing all of the different types of therapies and all the different types of ways that folks have to lose weight. In general, when it comes to willpower, I believe that just about all of us can lose 20, 30, 40 pounds if we want to. And the problem is that when we take a look at everyone who's able to lose that much weight through a calorie-restricted diet and increased exercise, it's almost 9/10 of them, almost 90% of folks are going to regain that weight plus a little bit extra. In my own life, I've probably done it 7, 8, 9 times where I've been able to lose that much weight and gain it back almost every time. What I'm interested in is, do we have therapies, do we have ways to help folks who are obese that are durable, that will last for years, that will last for the rest of a person's life? And I think that we have some really good tools to help people get there.